What kind of tests would you propose? Maybe a different, maybe subhuman primate model. What would you propose to do in the future to test such PSP particles?
Okay, question for you. What is the alternative test that you would propose to test those particles?
I think as an alternative test in animals, you have to look really very hard. Because as I've said earlier, there is no experimental test that's entirely adequate. I think, as I've said many times, tests in one species is hopelessly inadequate. We ought to be using two species of quite different anatomical and physiological characteristics. And I believe this is enshrined in a lot of newer legislation.
Dr. Borm? You had asked for the floor as well, in the same context.
I asked for a different reason because I noticed you were, I'm disagreeing with some of the stuff he's stating. I noticed you had a statement that Moore et al. Found non-dose-related tumor incidents, and in addition, in hydrophobic titanium dioxide, there was no tumor incident. I just would like to add that Professor Moore did not have access to the histology, so he has to make his decision based on the macroscopic tumor evidence, unless he had follow-up slices, which could happen, I don't know. The other remark is that if you have a hydrophobic titanium, and I know how they made it, I happen to know that within, let's say, 1 month after preparation in the lung, the hydrophobic coating is gone. So that actually may be a very interesting observation, why this specific titanium, for some reason, by having a 1 month coating, suddenly would lose its carcinogenic potency. So I was a bit puzzled by that remark in that slide. So I was hoping you can give me some explanation there.
I think that's an almost impossible question to answer. I mean, I don't believe there is any evidence, clinical or experimental, that titanium dioxide is carcinogenic. Remember, you can produce in rats just whatever you want to produce. You can produce tumors in rats with hypertonic sucrose by repeated insult. Nobody, but nobody is going to say that sugar is carcinogenic. So the rat is not a good species, and the model has to be viewed with a great deal of caution. You may get some basic information, but not in the present context.
Okay, thanks very much. You made that point. We received a couple of questions already during the break, one for Dr. Schultz in writing, and I'll read it to you. Dr. Schultz suggested that we need to reassess the tumors reported in relevant experiments. Are we therefore saying that there is still doubt about titanium dioxide causing cancer, even in rats, is the question to you?
Yes, we have to re-evaluate the tumors by a panel of experienced pathologists, not only to correct the tumors, also to say if the lesions are very red specific, non-seen in human, and the development of the lesions toward to maybe carcinoma. It is not a simple question. We said several days, I think 3 days, about the Lee study with pathologists and discussed about. And at the end, we have the result that the lesions are very red specific, and only one lesion was confirmed as a carcinoma.
Okay. Reaction?
Yes. To add to that, the fact that these experimental lesions, we know absolutely nothing about their behavior. We haven't done cytochemical studies. We haven't followed progression of these lesions. And remember, this study by Lee, which we've mentioning time and time again, there was a 12-month gap between the kills. This doesn't give us very much information on the development or the progression of the lesions.
I'd like to start with Dr. Schultz, but here are the others. The issue of malignant tumors seems to play a prominent role in the French ANSY's CLH proposal, because it seems to me that it moves up the proposed classification from a 2 to a 1B. So when they encounter what they called malignant tumors, starting with Dr. Schultz, how do those differ, and I think they do fundamentally, from human malignant tumors? I know you talked about it. Could you please reiterate that?
Yes, in human, I only saw primary mutation without inflammation, without adenoma-like structures and so on. And I have a discussion with Professor Overluster. We have really positive dusts, asbestos, amphibole asbestos, and silica on the one hand, and we have on the other hand almost harmless dust, coal dust. And in this range we can test the other dusts. And so we can propose to say the dust is hazardous or not. But with the tumor development, you cannot overtake from red to man. It is impossible. If you say you have a black box in rat and in human, yes, you can say, I have a tumor in rat, I have a tumor or neoplasma in rat and neoplasma in human. The other things don't interest me. But if you look at the mechanisms, they are quite different.
I have one remark on that, if I'm allowed. So I'm not involved in human pathology, but I did a lot of work in coal miners. So I would not say coal mine dust is a harmless dust, because you just say it's not carcinogenic. But coal mine dust has had a tremendous effect on huge populations, if you think about pneumoconiosis and emphysema. But that's a different pathology. But for some reason, that seems to be forgotten or is less scary than a tumor. Yeah? So that's basically one comment to that.
I spoke about coal dust, not about coal mine dust. Coal mine dust is often confounded by silica. And only coal dust is, in my point of view, not so hazardous, it's harmless.
Okay.
Okay, even if you question the malignancy of the tumors found in the Heinrich study, they are still adenomas. And as far as I recall from the glyphosate evaluation of the carcinogenic effect, IARC used the dose responses of adenomas, and although there haven't been increased carcinomas, they added both, calculated the dose response, and then said it is a positive dose response regarding tumors. And the question then is, what is the relevance of adenomas found in these animal studies for carcinogenicity predictivity or whatever?
But adenomas, you won't, as such adenomas. In very rare cases you found adenoma, but this is very different from such adenomas. But the adenomas in rats may be pre-malignant stage of carcinomas. It may be in rats, but I didn't find any adenoma, such adenoma in men.
But these adenomas occurred in long-term studies, 24 months, and still didn't develop into carcinomas. You know, that is the point, and they are still considered to be pre-malignant effects and with the indication of carcinogenicity.
I didn't see such lesions. I must see such lesions, but if I read the Heinrich study, it might be in rat a pre-malignant lesion, the adenoma, for rats. But in human, you will miss it.
Okay. Any other panel member on that? Yes.
I have a question on the importance of the Lee study. I find here a lot of debate around it. Listening to you, there are some serious shortcomings. Nevertheless, the study was one of the first to show effects of titanium. I was wondering about the strategic importance. Just bring it on the table. To kill the study, yes or no? I just want to have some answers from people here in the on the table. Is that possible? Because that seems to be a serious issue.
Okay. In your intervention, number 5.
Well, if I remember correctly, the study was done with a very poorly described pigment. We were not able to find a technical sheet to this material. We were not able to order the sample, so nobody really knows what it is. But pigments typically contain surfactants from milling. They may contain, or almost exclusively contain, light surface treatment. So we can expect some modifications of the surface, and as it was said, surface is the major thing, the major factor.
Can I comment? Because in the break you told me all the studies you reviewed, there was only one that accurately described the titanium. So why the Lee one? So that's why then push off Lee and not all the other ones?
Well, I'm not picking on you. I mean, you know, in general.
This is not a personal question, is it?
In general, we have not found a single study that was done with pure titanium dioxide, except for one USP grade material, which was used for dermatology studies. So inhalation studies were always done with materials that are either poorly described or were not titanium dioxide, so contained more than, say, several percent of fraction of different materials.
And now you're at 6 interventions. We're not going to give the floor to you because I'm afraid this is going to be yes and no. Or is there going to be something else?
I was just wondering where is this leading? Suppose you want, because my neighbor, he made a serious issue about the Lee study, that it's, yeah, you would be unwilling to believe the data that are produced there. But where would it lead this community to if you would burn off that study? Where there's still plenty of other studies.
I can see a finger waving at you here, Professor.
No. Coming back to Jan's comment, and I agree fully with Jan about this characterization of your material, what you're using. In fact, I would go even further, not just physical-chemical characterization, but also functional properties, which we have. But on the other hand, you could ask, well, what is more important? If you have a very pure, pristine material, which nobody's exposed to get some data, or would you rather use something that actual workers are exposed to and are at possible danger?
Answer? Any volunteers? Let's finish off with an answer, because this conference will have a few more opportunities for conversation on these topics, including in the final session. And you didn't expect a full answer immediately, Professor, did you?
No, I would certainly prefer something that people are exposed to test, rather than standing in the academic ivory tower and finding out what a pure material might do.
Thank you very much, Professor. A final thought, very, very briefly.
I have an answer for this. We used in a German project, NanoCare, in 2006 to 2009, we used industrial products that are very well characterized. And I believe this is the way to go into the future. We use the products that are on the market, packaged in a sack, and then you characterize it very perfectly in size distribution, surfaces, contaminants, and so on, and then you do it. And titanium dioxide was non-toxic. So that's it.
Thank you, Harold Krug. And now is the time for a short, brief, final thought from each of our panelists. And I'm going to start with you, a final thought to conclude, this session.
I mean, I conclude that one has to be incredibly wary in interpreting experimental studies in rats. Remember, this particular work which we're debating originates from the old school type toxicology experiment, where you work with a maximum tolerated dose to get an effect. You've got an effect in this situation. What do you do with it? What does it mean?
Okay.
Very, very subjective.
Okay.
Highly contentious.
Final thought, Dr. Borm.
I have the same feeling. We're talking about old school tox design studies with a mixed type of interpretation in pathology, which has always been around in this field. I have the feeling it's time to, what I said at the end of my talk, get out of the box, get out of this room and think about alternative approaches.
Dr. Schultz, what's the future?
The future, I don't know. But we have 2 steps, are not seen in human. The first step is after dust exposure, the inflammation and the adenoma-like structure. If we have adenoma-like structure after virus infection or paraquat, we don't have a development of a malignant neoplasia. And that's the difference.
And that will be the final thought for this session. Thanks to all 3 of you.